Welcome. This presentation is to help you understand your impairment rating under the EEOICPA Part E program. If you have a card like this, you have been accepted into the program. There are two parts. Number one, treatment of covered medical illnesses by a physician of your choice, and second, compensation based on a whole person impairment rating of covered medical illnesses. This uses the AMA Guides 5th edition. An impairment rating can be repeated in 24 months or greater for accepted medical illnesses. Covered medical illnesses. Illnesses accepted by the Department of Labor as having a 50% chance or greater as being caused by your work in a DOE facility. This is ICD code specific. Illnesses accepted by DOL as consequential to the above. These are also ICD code specific. The impairment rating physician cannot assign an impairment to an illness unless it is accepted and appears on the physician's impairment rating approval letter. Impairment rating, a translation of complex medical conditions by a trained physician into a number-based percent of a whole person to be used by non-medical administrative personnel for determination of compensation, impairment award. It is not intended for use in medical treatment or prognosis of medical conditions, but to calculate compensation. Physicians qualified to perform impairment ratings under this program must be a diplomat of the American Board of Independent Medical Examiners, knowledgeable in the application of the AMA Guides to the Evaluation of Permanent Impairment 5th edition, and approved by the DOL for this program. The American Medical Association Guides to the Evaluation of Permanent Impairment, 5th edition, is what is used. This is written into the law. Impairment rating process, the examiner's role. It is not a traditional doctor-patient relationship. No treatment or treatment recommendations are provided. The process is administrative and intended to meet the requirements of the EEOICPA Part E program. The report is not final until the Department of Labor approves. The examining doctor is responsible to notify you or your treating physician of newly discovered serious abnormal findings that may not be previously known to you or your treating physician. Impairment, a loss of use, or derangement of any body part, organ system, or organ function. It is based on anatomy, therefore performed by physicians. Disability, alteration of an individual's capacity to meet personal, social, or occupational demands, or statutory or regulatory requirements because of an impairment. Disability is a relational outcome contingent on the environmental conditions in which activities are performed. It is based on economic and social factors, and for this reason is performed by an administrative law judge. Maximal medical improvement, MMI, a condition or state that is well stabilized and unlikely to change substantially in the next year, with or without medical treatment. Over time, there may be some change. However, further recovery or deterioration is not anticipated. In other words, if there's something can be done to improve the condition, do that, stabilize, then do the impairment rating. Whole person. That's what describes us under the AMA Guides. We are made up of different organ systems as seen here. When you put them together, it makes a whole person or a 100% whole person. Imagine, if you will, an impairment of the respiratory system affecting 20%. That would be a 20% impairment of the whole person, 100% whole person. This is how an impairment is calculated for an accepted condition. Again, looking at impairment, here's an example. A loss of the little finger at the knuckle under the AMA Guides would be assigned a 5% whole person impairment, 5% taken away from the 100% whole person. Now let's look at impairment versus disability. Again, loss of a finger at the knuckle, a 5% whole person impairment based on anatomy. An attorney would have a 5% whole person impairment for this loss, but could do their work and may have minimal to no disability. A guitarist otherwise, who also lost their finger at the knuckle, may have a 5% whole person impairment, but possibly could not play their musical instrument or return to work their vocation. They may have a 100% disability. Again, we are calculating impairment under this program. Impairment for organ systems. Multiple illnesses of the same organ system. An example would be asbestosis and COPD. They both involve the respiratory system. They both have the same method of calculation of impairment, so the AMA Guides instructs the physician to calculate the impairment for each and use the highest of the two to represent the impairment for the entire organ system. Skin cancer is another example. There may be different types of skin cancers, separate lesions, and various locations. This is looked at as an organ system, and a single whole person impairment is assigned. As you would guess, the type of cancer, location, number would have a direct effect on the size of the impairment. Let us look at impairment calculations for multiple conditions. Each accepted condition receives its own whole person impairment. The whole person impairments are combined, not added. Here's an example. Condition number 1 would have a 60% whole person impairment. Condition number 2 is a 50% whole person impairment. If we were to add those, it would be a 110% whole person impairment, greater than the 100% maximum under the AMA Guides. Rather, we use the AMA Guides 5th edition method, and a 60% whole person impairment is combined with a 50% whole person impairment to achieve an 80% whole person impairment. The Department of Labor has the final say in determination of impairment rating. Until DOL accepts impairment rating determination, it is not official. The examining physician does not work for or have any administrative authority for the DOL or EEOICPA impairment rating. DOL can modify or change the method of the AMA Guides 5th edition. This is posted in their procedure manual. Process and review. Request for impairment rating to DOL of accepted medical conditions. Accepted conditions are at maximal medical improvement. Records reviewed, additional test ordered if needed to complete the impairment rating. The impairment physician selects the best method to calculate the impairment rating. Schedule evaluation by physician. This can be either via telephone or face-to-face. Impairment ratings for each accepted condition is combined to determine a final whole person impairment. Report sent to DOL claims examiner for review and copy of report to you for your records. Notification by DOL of acceptance of claim with % whole person impairment and compensation. This is a letter sent to you by the claims examiner. For subsequent impairment ratings, it is the % increase or change for which the compensation is calculated. If there is a decrease in impairment on subsequent evaluations, there is no loss of money, there is no loss of benefits. It is just that there is no increase in impairment. Thank you. I hope this helped increase your understanding of your impairment rating. Please consider watching this again after you receive your impairment report so you can see how your impairment was calculated. If you have further questions, please direct them to your impairment physician, their staff, your claims examiner, or your nearest resource center.